Welcome to the Childhood Trauma Learning Collaborative Membership Program Information Session. My name is Dana Asby and I'm the Education Coordinator for the New England MHTTC. I'm joined here today with Martha Staley, the Director of the Childhood Trauma Learning Collaborative, and we would like to acknowledge the unceded ancestral land of the Wappinger Nation, now known as New Haven, Connecticut, where both Martha and I are coming from. Unfortunately, our communication and program strategist, Ingrid Paget, is not able to join us today due to a Wi-Fi issue, so we will be presenting in her place. Our funding comes from the Substance Abuse and Mental Health Services Administration, and the opinions expressed today are those of myself and Martha, not SAMHSA or the New England MHTTC. The MHTTC network uses affirming, respectful, and recovery-oriented language. So please, if you are typing in the chat or asking a question during our Q&A portion, use strengths-based language that's inclusive of all cultures, genders, perspectives, and experiences, and keep your language healing-centered, trauma-responsive, person-first, non-judgmental, respectful, clear, and understandable. Your microphones will be muted during the first part of our presentation. If you would like to talk during the Q&A, go ahead and raise your hand and we'll unmute for you. If you have any questions during today's webinar, please do type that in the chat or raise your hand. And after the session, you can send any questions to me via email. My email is right there, and you'll also receive this slide presentation and a recording of today's presentation via email. I'll pass it over to my colleague, Martha Staley.
Hi, everyone. Welcome to this information session for membership in the Childhood Trauma Learning Collaborative. We are so happy that you've joined us to hear more about our program and what we offer. Today in our short meeting, we're going to give you a very brief overview of what the Mental Health Technology Transfer Center is and what the Childhood Trauma Learning Collaborative is. A brief look at our racial equity and cultural humility initiative within New England, the benefits of CTLC membership, and open it up for questions and answers, as well as sharing some of our upcoming events. So my name is Martha Staley. I'm the director of the Childhood Trauma Learning Collaborative and a member of the faculty at the Yale School of Medicine, Department of Psychiatry, Program for Recovery and Community Health. If you are new to what the MHTTC network is, I'm just going to give a very brief overview of it. It is a regional and national network. It is a national network of regional centers throughout all the parts of the United States, and includes another center for Latinx and Hispanic communities and one for Indigenous, Native American, and Native Alaskan communities. Every network center has a particular focus and mission. Ours is based on recovery-oriented practices, recovery support services, and resilience within the context of recovery-oriented systems of care. Our mission is to use evidence-based practices to disseminate evidence-based mental health practices, supports, and technical assistance, particularly across the New England region, although we know that many of you are not based in the New England region, and that is totally okay. I want to let you know that you, no matter where you are, have a regional center that is available for region-specific support and resources, and you can find that at the MHTTC network page. But you're all welcome here, and we'd love to have you no matter where you're based or what type of organization you're in. Our New England MHTTC is led by this Yale program for recovery and community health, but we partner with the Harvard University Department of Psychiatry, C4 Innovations based outside of Boston, and the Center for Educational Improvement. As I mentioned, our focus is on recovery and resilience, and we have a number of recovery guiding principles that we use that are also reflected in the language slide that Dana shared at the beginning of the presentation. But our guiding principles are based on the importance of putting people first, of including a number of perspectives, especially including perspectives of people with lived experience, focusing on strengths and recovery, and understanding that recovery and resilience occur via many pathways and with the support of friends, people with lived experience, community supports, and others. As Dana said, we are funded by the Substance Abuse and Mental Health Services Administration. And every network regional partner within the network also has a school mental health initiative. And that is what the Childhood Trauma Learning Collaborative is based in. So the Childhood Trauma Learning Collaborative, the CTLC, is an initiative of the larger New England MHTTC in our school-based mental health initiative. Along with the CTLC, we have a number of other initiatives that you might be interested in learning more about, including learning collaborative based around early psychosis, our Heart Collective work, which we'll tell you a little bit more in a minute about, our Reach for Organizational Change Learning Community, our Let's Lead Lived Experience Transformational Leadership Virtual Academy, an initiative focused on healthcare worker well-being, and our CTLC. But check us out for a number of resources and learning opportunities in those topic areas. So what is the Childhood Trauma Learning Collaborative? Our mission is to use an evidence base to enhance school culture, to improve school-based mental health and local capacity to deliver and support school-based mental health, and to provide pre-K through grade 12 educators access to mental health resources and strategies, to deepen their awareness of childhood trauma, to help transform school systems to support kids and promote resilience, to increase social emotional competence, to accelerate learning, and to strengthen school and community health collaborations to support the well-being of students, but also of the larger school community, teachers, families, and community members. So that is a brief overview of what the CTLC is, but Dana will tell you in a few moments some more specific activities. In addition to the CTLC, we also have the Heart Collective, which is specifically focused on the partnerships and collaborations between school communities and community health. We have revised our compassionate school mental health model for school-based mental health. We've convened a committee to center on barriers and best practices for school and community health collaborations. And shortly in the future, over the summer and into the fall, we are beginning to develop a learning collaborative around strengthening, deepening these collaborations between schools and healthcare partners in order to support school-based health. And we feel that this is particularly important for people for whom there are not a lot of resources within school to support mental health. So when schools are sharing school social workers or school psychologists, or are having issues with community capacity for mental health services for kids, we see building these partnerships as a key practice to help deliver more mental health services to kids and their families. We are also working on a public mental health awareness campaign and a website with a ton of resources in this area, no matter where people are in developing these collaborations and partnerships. And we will be developing a very brief self-directed online course about how to begin thinking about these collaborations and navigating some of the challenges within those collaborations. Right now, I believe that our colleague Ingrid has joined us despite her Wi-Fi issues. So I'm going to pass it to her to tell you a little bit more about our Better Together initiative.
I am
Ingrid?
here, Martha. Thank you so much. I'm sorry that I can't be visible on camera with you all, but I'm having an internet challenge, so please forgive me. But it's my pleasure to talk to you about what we're doing around racial equity and advancing cultural humility in New England today. You can go to the next slide. So we know that the New England MHTTC is already a culturally responsive organization, but our specific outreach to individuals and communities of Black, Indigenous, and people of color, BIPOC, is a proactive effort to really amplify the voices and perspectives of people with lived experience. You can go to the next slide. And we know that there's a compelling and urgent need for this work right now. Again, as a part of our call to action from SAMHSA, I kind of wanted to highlight this quote around, understanding that the COVID-19 pandemic, as well as the economic crisis and kind of widespread racially focused protests, are highlighting glaring inequities for racial and ethnic minority communities. And so we see this as a call to action, again, because these crises have significant implications for mental health, and they exacerbate already poor access to behavioral health services in BIPOC communities specifically. So what's our vision? We really want to build community, to help you build partnerships, to learn more about your stories and what you're doing in your communities and schools and organizations around this work. So we invite you to take a seat at our training table. Martha talked a lot about kind of training in other areas. We are specifically doing racial equity and advancing cultural humility as a learning community, and that's an acronym, so REACH for organizational change, and that's really what we want to help people to do. There are 3 ways to engage in this opportunity. There's universal training, targeted training, and then we'll also have a more intensive opportunity, which will be an application-based 12 to 15-month opportunity for you to join our learning collaborative around racial equity and cultural humility.
Thank you so much, Ingrid. So as Ingrid mentioned, the New England MHTTC does consider itself a culturally responsive organization. So in the CTLC, we're also trying to advance some of those strategies and efforts. And we've been doing the CTLC for almost 3 years now. We're coming to the end of our 3rd year. So I'd like to talk to you a little bit about how the CTLC began and where we're going in the future. So we started the CTLC based off of a needs assessment, and each year we do another needs assessment to try and figure out what schools and districts in New England need to support their school-based mental health systems. So during COVID-19, some of those things changed. We found that there were certain schools where the basic needs for vulnerable students were not being met. Our fellows and other members of the community let us know that the lack of connection due to not being able to be in person was really challenging. There was a lot of conflicting, confusing, and missing guidance around how to do mental health as we went to remote learning. There was also a lot of confusion around privacy and legality for mental health. And then the pace and depth of change was challenging. And for special education and mental health services, there was just a wealth of information to sift through. And pretty universally, we heard an increased need for understanding of trauma-skilled practices with schools. So if you're looking at this list, if you want to type in the chat to let us know what one of the biggest stressors in your communities during COVID-19 was, that would be great. So we took this into account, and we delivered training and experiences that met those needs for our fellows. So I just want to talk to you about how we developed our compassionate school mental health model. Martha, who has been with us from the beginning, as well as our chief advisor, Dr. Chris Mason, they envisioned the CTLC as a way for us to really talk about comprehensive mental health services from a compassionate perspective. And what we do at the CTLC is really all about building compassionate communities. And we know that youth are touched in so many different places. So we've put youth at the center of our framework, and we want to talk about how adults interact with youth at the home, at the community, at the school, and at various systems levels. So justice system, and the school system, the healthcare system, the mental and behavioral healthcare systems, all of those things coming together. And you'll see that we have 4 basic quadrants that we believe all need to be happening at the same time. So prevention, reducing the causes of trauma, which can be accomplished through evaluating systems, holding them accountable, advocating for change, providing necessary resources in an equitable way, educating the public about mental health and how to support well-being by promoting holistic wellness. We also believe it's important that we support youth by identifying those in need using trauma-informed screening practices, connecting families and youth with resources throughout the community, delivering school-wide programming on mental health support and well-being, and creating opportunities for students to be leaders and to have new experiences within their communities. We also think it's very important that schools work together with community organizations and families to build resiliency through increasing agency and social emotional learning skill sets. And schools have a great responsibility to empower and lift the voices of families and students. So we've worked a lot with our C-TLC fellows on that point this year. Our last quadrant is about developing protective factors. We believe that fostering nurturing adults can help build those compassionate communities. And we know that when children experience trauma, having one single adult who is caring in their life can be a great buffer against those negative effects of trauma. So everything that we do is about building compassionate and equitable environments and cultivating a sense of community. And we think that the biggest thing that we want to do is get those ideas out into the New England region and the US as a whole, because we know that research has shown that mindfulness can be a great healing practice for those who've experienced trauma and can also buffer against future instances of trauma and promote resilience. And nurturing adults in a stable environment are also one of those buffering factors. So what we do is we try to help disseminate trauma-skilled practices that help leaders develop compassionate communities. And so we started with our CTLC fellows, which are a diverse group of educational leaders. They are district leaders, school administrators, school psychologists, social workers, and we take a systems approach. And we also use our school compassionate culture analytical tool for educators, a brief online assessment tool that helps schools plan, envision, and monitor their progress towards becoming a trauma-skilled school. So on year 1 of the Childhood Trauma Learning Collaborative, we had 24 fellows, and we did some training on neurobiology of trauma and stress, mindfulness, and trauma-skilled schools. And the fellows shared with each other the best practices for cultivating compassionate school communities with each other. We also convened some meetings between fellows and state and regional leaders. In year 2, most of those fellows continued on with us, and we recruited a few new ones. And we continued providing training on those same topics from year 1, but we went a little deeper. And then we added some training on equity in education during year 2. We continued with the sharing of best practices amongst our community, and we had more meetings where fellows got to hear from and network with state and regional leaders. And the fellows began using our SCATE assessment to look at which areas of school culture they most needed to focus on to become a trauma-skilled school. We also introduced them to the compassionate school mental health model that we just showed you. Now, year 3, this year that we're about to wrap up, we introduced junior fellows. So we brought on some new fellows that senior fellows then began to mentor. We changed our focus for our training to be listening sessions because we listened to our fellows who told us that the didactic webinars were a little too much during COVID-19. So we did listening sessions instead, and we focused on mindful leadership and visioning, how to work with families, and how to improve staff wellness. We also introduced a program called Compassionate Conversations, where we provided our fellows with tip sheets on wellness topics, and we held space for them to share their challenges and ask questions around wellness topics. We also provided individual technical assistance to certain schools and districts who needed specific trainings, and continued the use of our SCATE climate assessment. Finally, we asked our fellows to help us disseminate the compassionate school mental health model throughout the region. And we did that in conjunction with our Heart Collective, who helped us revise that. Here are just a few of our fellows, and you can see a picture of many of them from one of our in-person meetings. They are really a great group of folks who are doing this work throughout the region in a wonderful way. And in year 4, we're excited to expand our capacity. We're going to continue on with a lot of those things I mentioned in year 3. We're also going to start providing TA to Project Aware grantees, and we're going to hopefully do some school site visits as well. And you're here today with us because we're trying to increase our capacity by bringing more members into the CTLC, including not just schools and district, but healthcare centers, mental and behavioral health agencies, and community-based organizations that work with youth. We want this work to be happening in all arenas because we know that all of these different types of organizations touch youth. So you'll get this slideshow as a follow-up to today's meeting, where you'll see some of the products that we've created in the past, and we'll be continuing to create the products that New England educators and organizations tell us they need to help address childhood trauma. We also have a Basecamp community where folks in New England and outside New England are welcome to join and receive topic-based resources and invitations to webinars, as well as research, and ask questions of the researchers and experts that we have running Basecamp. And you'll receive an invitation to join Basecamp as well. So I'm going to pass it back to Ingrid to go over the benefits of joining the CTLC.
Great, thank you, Dana. And so just to kind of put a bow on it, most of the things Dana has talked about, but members have first chance access to webinars, events, and resources. Of course, priority opportunities for heart-centered learning stipends, which are small amounts of money that we work to give schools directly to support social emotional learning initiatives and supports. Free access to SCATE, our school culture climate assessment. The short-term technical assistance opportunities, which we mentioned. Access to our Basecamp platform, where you can get free resources on school mental health, social emotional learning, and trauma. And we've added some equity pieces to that as well. And then, of course, networking opportunities with leaders throughout the New England region.
So we realize that we don't have a lot of time left, but we do want to open it up if you have questions for us about the CTLC or membership or anything that we've talked about today. You can either ask in the chat or unmute yourself.
I'm curious to know if you can, if there's a list of who are members, and if there's, who the members maybe are out in Western Mass.
Yes, we do have a listing of our fellows. Hopefully Ingrid or Martha can pop that in the chat, but I know that we work with Joelle Bruckner, who is out of Williamstown. Ingrid or Martha, can you think of anyone else in Western Mass? Kate Retzel out of Lee Elementary.
Yes, but we can also look too to see, we can't provide, direct information, but we can at least provide the names of schools who are members in that region.
And we are always looking for more schools and organizations to join, and particularly connect through the Basecamp collaboration site. So if you know of any, send them our way. Any other questions before we tell you about upcoming events? Okay. So coming up in the next couple of weeks, we are having our very own Dana Asby talk about self-care for all, strategies and habits to infuse wellness into your daily life. That will be on June 16th. That is going to be an action-oriented, concrete strategies about how to take care of yourself during stressful time, if anybody could use that. We are also continuing our Family Compassionate Conversation series with for Wellness for Latinx Families, which will be conducted entirely in Spanish with the director of our New England MHTTC, Maria Restrepo Toro. So we invite you to that, and that is open to all families and monolingual Spanish speakers who are looking for support around caregiving, particularly during COVID-19. And we are finishing up our National School Mental Health Best Practices Framework Implementation Guidance Series, which is called Always and Now, which is an 8-part learning series. It's all recorded and archived on the MHTCC webpage, but our final session is about impact and school mental health, universal school mental health, which is Tuesday, May 25th. We'll also be having regional breakout sessions after that module session. So whether you're in New England or somewhere else, everyone is invited to spend half an hour after the presentation asking questions and engaged in discussion about the module or anything about the implementation guidelines and framework. So if you have any if you have any questions, if you want to know more, if you want more specific direction to resources, please feel free to email us, come to our website, sign up for our newsletter, and you'll receive all of this information and our invitation to Basecamp after the presentation. Dana?
Thank you all so much for joining us. And a reminder that our work is funded by the Substance Abuse and Mental Health Services Administration. So please do stay posted for any updates. Lori has already said in the chat that she's interested in becoming a member. If anyone else is interested in becoming a member, you can email me or you can put that in the chat and we'll email you. It's a very brief 1-page application, and those who do officially become members will be invited to certain fellow member organization meetings that will be upcoming in the summer and the fall. That's all I have. How about you, Martha?
We just want to thank you for being here today. We hope to see you at our events and on Basecamp and sharing resources and support to continue the work that I know that you're all engaged in. And we appreciate everything that you are doing and the time that you've spent with us today. And we hope that if you're inspired, that you will spread the word and join us. Thank you.